Chest pain is not an uncommon symptom nowadays because almost everyone at some point in their life would have had experienced one or the other form of chest pain. Amongst all the pain elsewhere in the body, the chest pain has some threat value attached to it. Because of the close proximity of the heart to the chest, it is unstoppable for the patients to not think about heart when they have a chest pain. This is especially true when at present so many younger generation are victimized for heart related ailments and heart related deaths. So it is obvious and understandable that chest pains are always having some importance compared to any other pain in the human body. It is imperative to pick up the early warning signs of chest pain because it is something to do with the life of the individual. But at the same time, it is important to rule out the other reasons of the chest pain because oftentimes people get confused between cardiac related chest pain from other reasons of chest pain. People unnecessarily worry and end up getting most of the unnecessary tests for themselves. Since I am a pain physiotherapist, since I see a lot of neck pain patients coming to me who is also complaining of neck related chest pain, I found a pattern that the neck pain can easily cause the chest pain as well. You know what? The neck pain or the cervical spondylitic related neck pain are alarmingly increasing in the past 5 years that the clinical symptoms and presentations are so varied, which includes chest pain. So I thought I'll make a video to give the clarity to the public that what is the difference between neck related chest pain and cardiac related chest pain. Though I am not so much qualified to talk about cardiac related chest pain, I know a lot about the neck related chest pain, so I can give some fundamental differences between what is neck related chest pain from the cardiac related chest pain. But if you still have any doubt, you consult your physician because my video here is only for the educational purpose, not a real-time patient consultation. Because the neck pain and cervical spondylitic prevalence is high nowadays, the number of people who are suffering from neck related chest pain is high in number compared to the number of people who are having cardiac related chest pain. So I thought, okay, this is important for the patients to understand, to discern between cardiac related chest pain from the cervicogenic related chest pain. If these patients know what is their characteristics of the chest pain and where it is coming from, it will be useful for them to take the necessary actions. So let me list out the differences between cervical related or cervicogenic chest pain from cardiac or cardiogenic chest pain. First, the pain locality. In cervicogenic chest pain, the chest pain can be right, left or both the sides or center or chest pain with radiating pain. Whereas in cardiac related chest pain, the chest pain will be mostly confined to the left side or in the center or behind the back, or sometimes it can go to the jaw and sometimes it can go to the left side of the arm. But it will hardly go to the right side and it cannot be both the sides together. So that is one differences in terms of the locality. Secondly, the pain nature. The pain nature in cervical related chest pain would be diffuse or sometimes local. What is local? Patients can oftentimes pinpoint their pain. They say that my pain is here, doctor, or my pain is here, doctor. So when the pain is local, it is definitely not cardiac related chest pain. Because in cardiac related chest pain, the pain will be mostly diffuse in nature. They will not be able to pinpoint where the pain is. It will be more of compressing or congesting or tightening type of chest pain. In that way, in cardiac chest pain, the pain nature is diffuse. In cervicogenic, the pain nature can be diffuse or local. If it is local, means if the patients are able to pinpoint here and here and here, then it is always cervicogenic. The pathophysiology of the cardiac related chest pain is largely ischemic in nature, which is nothing but reduction in the blood supply to the myocardium, which refers pain to the corresponding nerves. So that is ischemic referred pain. Whereas in cervical related chest pain, the pain is largely mechanical in nature. That's why when they start doing some movement, the pain can get influenced. Some of my patients say that, doctor, when I do this, I get chest pain here. When I rotate like this, I get the chest pain here. So these are all movement related pains. These movements will compress or irritate one or the other nerves which produces the pain in the chest. So it's mechanical. Sometimes it can be inflammatory also. The constant compression of the nerves in the neck can secondarily produce inflammation around the nerves. So the nerve will become edematous that can cause resting pain in the chest. So it can be mechanical, it can be inflammatory, and the nature of the pain can be referred or even radiating. So some of my patients, they'll have chest pain as well as radiating pain to the arm. The pain nature falls under the category of both radiating, which is nothing but a nervy pain as well as referred pain, otherwise called as somatic referred pain. That means pain from the cervical spine can directly refer pain to the back of the shoulder blade or to the front of the chest, which we call it as a somatic referred pain. One hallmark feature of cervical related chest pain is pain on touch. These patients will also identify the certain painful spots and they can recognize that it is painful on touch. They can touch here and can feel the pain, they can touch here and can feel the pain, and they can touch here and can feel the pain. This is not the case with cardiac related chest pain, because cardiac related chest pain is referred and it cannot be felt on touch. This is one key difference. The next cardinal feature is sensory manifestation. Because the cervical spondylitis can affect the sensory nerves, patients oftentimes can feel not only pain but also tingling, numbness and paresthesia. This tingling and numbness paresthesia is indicative of the nerves which are responsible for the sensation, they are also affected. So when they are affected along with the chest pain, it is easy to understand that what you have is the cervicogenic chest pain. What causes the tingling and numbness is what is also causing you the chest pain. Whereas in cardiac chest pain, you will never have tingling, numbness in the little finger, somewhat paresthesia in the fingers. It is only pain, no sensory manifestations like tingling, numbness and paresthesia in cardiac related chest pain. So when there is a sensation affected, it is neck related. When the sensation is intact, then it is cardiac. The next difference is with respect to the duration. The cardiac related chest pains, they always start as acute pains or sometimes subacute pains. So they will be having suddenly some pain, and then the pain will be keep on worsening, or the pain will go away, after some time it will reoccur. But this pain will never happen for many months or years together. Either it will be subacute for 1 week or 10 days, or max to max about 2 to 3 weeks they will have. After that, if it is a cardiac pain, it will always show up. The cervical problem will be always chronic in nature. So my patient, they will always say, doctor, my pain, this is there for many months, this is there for many years sometimes. When the pain is in the chest for many years, it cannot be cardiac related, because cardiac related chest pain will always exhibit sooner than later. The neck related chest pain will mostly exhibit later and it will be persistent for a long period of time. So when the pain is there for many months to years together, then you can blindly say that it is neck related chest pain. With respect to movement, as I already mentioned, if it is a cardiac related, no movements or positions can influence the pain, whereas in neck related chest pain, the movements and positions can influence the pain. Especially my software patients who are working in front of the computer, as they sit more and more, they get more chest pain. As they move around, the chest pain may go away. Or in the night, when they use 2 pillows, they get chest pain. When they remove the pillow, the chest pain may go away. So whereas in cardiac related chest pain, no movements or postures can influence the pain in their chest. And lastly, the people who are having cervical related chest pain, you also have to examine the neck. If they have pain during neck movements, if they have radiating pain, if they have symptoms of radiating pain, or if they have the history of chronic cervical spondylitis, it is likely that their chest pain is also coming from the neck. People who are having cervical spondylitis will also have gastric related symptoms, and many people get confused with this gastric symptoms to the chest pain. But in all these patients, it is their neck pain which causes both chest pain and the gastric symptoms. So when the neck is resolved, the gastric pain as well as the chest pain would go away. The cardiac related chest pain will not play hide and seek game. Just comes, strikes, and then it will reveal that it's a cardiac problem. Okay, if not acute, but in a subacute manner also, within 1 week or 2 weeks, it will exhibit. It is not that kind of presentation with cervical. Cervical is always movement induced, posture induced, and it will be long lasting and it will be diffuse. It can be having sensory manifestations, and these people will also have one or the other form of neck pain, early morning neck stiffness, catch in their neck muscles and catch in the behind the back shoulder blade muscles, and sometimes the same catch will come to the chest. So by all these symptoms, we know that the pain in the chest is not cardiac in origin, it is cervical in origin. If it is cervical in origin, then you have to go and meet a physiotherapist and get your cervical spine addressed so that the chest pain might go away. If you don't address that, the chest pain will not go away because it is very close to the heart. These patients will always worry that the chest pain is coming from the heart, and their life will become very miserable and they can't sleep in the night peacefully because they always will have something in the back of the mind that they have a cardiac problem. I hope I made it clear about the cervical related chest pain and how it is different from the cardiac related chest pain. As I mentioned, it is only for educational purpose. If you are having any doubts, you consult your physician and get yourself thoroughly evaluated for cardiac related chest pain, because that is something which is very important to be addressed at the earliest. I hope this video is of some help to you. I will see you again in one more video. Thank you.